6-year-old child killed by wrong medication. Guys, again, these are just the ones being reported again, man. 6 years old. Who killed everyone involved in the operation? Let's read here. Man, inevitable, man. They weren't supposed to die. Inevitable. Died on the wrong day. It would have been better if you had stayed home. Have you stopped to think about that? Nobody asked anyone to be a healthcare professional, man. Pay attention, study, sit your butt down, or quit. Another kid dying out there. Man, imagine if it was your child. Can you imagine if it was your child? Would you think it's cool? Wow, that's cool. My son died because a guy didn't know what he was doing on his workday. The guy didn't read the prescription. The guy anyway, the one who made the mistake was the doctor. Because of one person's mistake or another's, someone dies. If it was your child, how would you feel? It's outrageous. I feel outraged by this. But anyway, let's go. I'm not even going to ask for likes or comments or anything. Do whatever you want because this really made me very sad. You have no idea. Guys, here's the thing. Look, the news is from the state of Amazonas, okay? Amazonas is in mourning and demands answers. There's a serious accusation of medical negligence at Santa Julia Hospital after the unacceptable mistake resulted in the death of little Benicio Xavier de Freitas on November 23rd, just recently, man, at the end of the year. Benicio was admitted to the facility with a health condition that, by any standard protocol, would be considered simple and treatable. Symptoms of pharyngitis and flu. However, what should have been a routine care admission turned into a tragedy due to a primary and fatal failure in the procedure. The core of the complaint lies in the incorrect administration of the medication. Someone gave the wrong medicine. According to the family's reports, a drug that should have been administered orally was inexplicably given directly into the intravenous line. This act, attributed to the hospital's on-call doctor, constitutes a professional lapse of devastating magnitude. An error of this nature cannot be classified as a mere accident, a systemic failure that cost the life of a child. New information has emerged about the death of Benicio. The doctor who prescribed the overdose of adrenaline to the boy is Juliana Brazil Santos, who graduated in 2019. Anyway, I want to know where she graduated from. According to the family, Juliana attended to the child and ordered the administration of adrenaline intravenously. Benicio had arrived at the hospital on the 22nd around 1:28 p.m., presenting with a dry cough and suspected laryngitis. The medical prescription instructed the administration of 3 ml undiluted every 30 minutes 3 times. The writing here is wrong, isn't it? 3 ml undiluted adrenaline every 30 minutes 3 times. 1 milligram totaling 9 meg in amount that, according to the specialist, is considered up to 15 times higher than the recommended dose for a child of her weight and age. Although the stamp used on the prescription mentions pediatrics, a CRM consultation shows that Juliana Brazil is only registered as a general practitioner with no specialization. Blah, I'm not even going to read the rest, it doesn't matter, she's dead, man. I don't know which is worse. Medicine or nursing, I don't know, man. Honestly, I don't know how many times, man. I don't know how many videos I've made on this channel talking about adrenaline. Intravenous pure is only used in cardiac arrest. In adults, man, for God's sake, go back, look here, search. You'll find me saying this here. Look, 1 milligram of adrenaline pure only in a patient in cardiac arrest, adult patient in cardiac arrest, and no one else. You're going to give pure intravenous adrenaline to a child. I'm not even going to get into that, man, for God's sake. It's the doctor's fault, but also the nurse's, since the nurse administers it. Damn, man, what a mess. You just can't. Man, these are really hard mistakes to swallow, man. Not even an adult in a cardiac arrest gets 3 ml of adrenaline, man. Not even an adult, you know? Even if the guy's down, he doesn't get 3 ml, he gets 1 ml, man. You guys need to sit down and study, for God's sake. This is an unacceptable mistake. Man, it's the doctor's mistake, it's the nurse's mistake. I'm not here to cover for the nurses. It's not about our category, man. It's us who carry it out. We gave the medication, not the doctor. She made a mistake, and so did we. Someone died. The point is, someone died. It could have been my child. It could have been your child. It could have been me. If I, as an adult, get 3 ml, I'll have a cardiac arrest too. I'll die, man. You'll die too. If someone gives you 3 ml in your life, you'll die. Do you know what adrenaline is, what it's for? It's a drug that binds to the beta-1 receptor, man. The heart rate goes way up. It's going to make the guy explode. In other words, the heart can't take it. It's too much adrenaline, and in a short period of time, nobody's heart can handle it. So guys, it's a basic mistake, a mistake of, let's say, man, I think everyone should, I don't know. I don't even know what Curia Amazonas is going to do. I don't even know what Curia Amazonas is going to do. The CRM, I don't know. Each one. I'm talking about nursing, right? Anyway, that's why I always say, stop being afraid of doctors. Stop not learning what you have to do. Look at the prescription and understand it. Question how it is. Doctor, you went crazy. You should have gone to the doctor and said you went crazy. Look what you're about to do to a child. You don't even need to be a pediatrician. Anyone who studied the basics knows that pure adrenaline is only for a patient in cardiac arrest. If you didn't know that, you shouldn't even be on call. Sorry, you shouldn't even be working in an emergency. And another thing, that adrenaline was supposed to be given intramuscularly according to the child's weight, not intravenously, not diluted. It was supposed to be intramuscular or by nebulization, and not orally either. No, adrenaline is not given orally. It's a vasoactive drug. Adrenaline is a vasoactive drug. It can't be given orally, by nebulization, or intramuscularly. Would it solve the laryngitis? Never intravenously, never in this situation, never at this dosage, for anyone, not even an adult patient. So guys, for God's sake, sit down and study before someone dies. If you don't know, study, sit down and learn. If you're not prepared, buy a course. No one asked you to be a professional. Healthcare pays little, I don't care. I earned very little. Working 9 months before getting my first opportunity, which was just a favor. The money I made covered nothing. In other words, I wasn't born knowing either, but I studied. I sit my butt down and I learn, just like you should sit your butt down and learn. When I graduated, there was no YouTube. Nowadays, man, there's a ton of free content. You don't even need to buy anything. You just have to sit your butt down and search, just on my channel. I don't know how many times I've talked about epinephrine. I don't know how many times I've talked about epinephrine. I've compared epinephrine with norepinephrine. I've already talked about all the uses of epinephrine. So it doesn't make sense, man. I don't know, man. I'm glad I'm not part of Quorum because that makes me extremely upset. You didn't see it, so what are you doing on duty? Aren't you reading what you're supposed to? You'll put lives at risk. For God's sake, don't make mistakes. That's why I always say this. I like to teach. I go really deep into the content I give my students so they have knowledge, even if they don't prescribe, because when someone on the other side with a CRM prescribes something wrong, you also have the knowledge to argue scientifically. Now, if you don't want to study and just do everything carelessly, this is what happens. Someone died, someone is crying, just imagine the trauma left in the family, right? I'm not just talking about the parents, it's the whole family. A 6-year-old child who won't spend Christmas, won't spend New Year's. Imagine that the end of 2025 created a huge hole in the lives of these parents, this family, because someone made a mistake. It would have been much better to leave the kid at home, much better to leave the kid at home feeling sick than to take him to the hospital and have him die. Given the state of education in Brazil and how professionals work, things are bad. Maybe it would have been better to go to the hospital. Just look at the problem. Where the care ends with someone leaving in a coffin, guys, it's sad, you see? And look, it's not for lack of knowledge, no, because here, look, transforming nursing in Brazil, I try, man. But you guys also have to do your part. You have to watch the video until the end. You have to see there are more than 2,000 videos here, man. So in other words, there's no excuse. And I can say, you have to improve a lot. That's why nursing and medicine are just going downhill. Every day, there are a lot of unprepared professionals working and even more unemployed. Why? Is the education bad? So look, take advantage, study, because if you don't, more people are going to die. I hope nothing bad like that ever happens in your life. That you never lose a relative because a professional did something wrong. You feel it in your skin so much that it hurts, that when someone dies from a disease, it's bad, but you accept it because it was a disease. Now, when it's a mistake, look, I don't even want to imagine.